Here we have a patient who has between the two front teeth a very small space. You can see it if you track the point 3 and you follow that black line down. That gap between the teeth at the gum line is what we call a dark triangle or a black triangle. And the reason for that is because this patient's teeth were overlapped to start the treatment. And now the reason they are like that is because if you notice, the shape of the teeth is such that if you trace down the screen from where the green colored space is, you'll see the teeth meet towards the edge. Now I'm going to move my cursor. When I move it, the space will look like it's going to disappear. And that's really the main point of this video. But we're talking about this region from here to here. You see how they're only touching at that point. Why is that? Well, the reason is the shape of these two teeth, if you look very carefully, especially the one on the left of the screen as you look at it, which is the patient's right central incisor. In this area, right in here, there's a concave area. You see that? And you see how the tooth swings out wide, almost like a pear. It's a little bit the case as well on the patient's left central. If you look, the point where they're touching is the widest point. So when we do interproximal reduction to reduce the dark triangle, we are only filing, is really the term that it's hard to get away from, but some people call it polishing or reshaping, the portion of the tooth that is touching so that the teeth can be moved closer together. And the degree of the amount that we're making is 0.3 millimeters. So to give you some perspective, first of all, most orthodontists use an instrument that's split evenly on one side and the next. So really we're removing 0.15 millimeter of enamel from each side from this tooth and 0.15 from this. This tooth is 9 millimeters wide. And we are removing, and some people call this slenderizing, by the way, 0.15. So you can actually see that in the before and after, this tooth, if you look at it, aside from the gap closing, there's really no change at all to the shape. There is micro change at this point, but it almost looks better. And it's a really small amount. The tooth will go in width at the widest point from, say, 9 millimeters to 8.85 or something like that. So interproximal reduction, there's a lot that's misunderstood about it. And quite often, if you know where to select the spaces in other areas, in crowded cases, you're doing it in a point contact where you're not filing the whole aspect or the whole side of the tooth. And this is a perfect example.